The findings of a recent air quality monitoring survey released by Greenpeace have found that the deadly PM 2.5 levels in Delhi are 10 times higher than the maximum safety limit prescribed by the World Health Organization and 4 times more than the Indian safety limit. I'm going to take you across to our big graphic screen and show you why this is as dangerous as it is. Let's just take you through how Delhi compares with Beijing. And this is very crucial because the general notion has been that Beijing's air is far worse than any other city in the world and that Delhi is actually much better. You need to look at the red worm on your screen. We're talking about PM 2.5 here, which is one of the measurements for pollution, and I'll tell you a little bit more about it in a moment from now. For a very long while, you see the red worm and the yellow worm very close to each other. But here, as you come towards this winter in 2015, just look at how the red worm, this is Delhi, jumps over Beijing. In several places, the gap is almost 75 points between Delhi and Beijing. And if you see also, the Beijing worm is actually coming down. They've been able to deal with this problem. Their pollution worm is on a declining graph, whereas in Delhi, just look at how the pollution levels have soared, which is why a lot of people in the capital had huge problems breathing in the winter. That's because this worm is rising and rising really fast. And it's not just Delhi, mind you, that has a very severe problem. Take a look at the other cities, because the WHO data released recently says that out of 20 cities in the world, 13 of the most polluted cities, 13 of the world's most polluted cities are in India. And here they are, because you've got Karachi, you've got Peshawar in Pakistan and Rawalpindi. Those are the 3 Pakistani cities. Then there's also an Iranian city. But that apart, a majority of the world's most polluted cities, as per today's standards, as per pollution levels today, are actually in India. And these are some cities that you don't particularly associate with a lot of pollution. But then there's Bangladesh there, there's Pakistan there, there's Iran there, and 13 cities on that list. Allahabad, Agra, Khanna in Punjab, Delhi, all these are Indian cities. And that's how bad the pollution is. So what is PM 2.5? It's critical to understand why this one measurement is being taken so seriously all across the world. That's particulate matter less than 2.5 micrometers in diameter. This, according to experts, poses the greatest health risk because it penetrates deeply and directly into our lungs, which is why PM 2.5 is taken very seriously. And on the PM 2.5 scale, it is fairly clear that India is sitting on a pollution time bomb. Let's take a look at what levels are acceptable to the human body and what are not, and then we'll be able to better understand the problem. You know, it's between 0 and 5. Remember, those figures went up to 799 in the peak of winters. 0 to 5 PM 2.5 is actually good. 51 to 100 is moderate. The impact that this has is that sensitive individuals may experience respiratory systems between 50 and 100. Then there is 100 to 150, which is unhealthy for sensitive groups over here. If they're pregnant women or they're young children, old people, they have lung problems, increased aggravation of heart or lung diseases, premature mortality in people who have lung problems. Then there is 150 to 200. Remember, the figures we're talking about are way in excess of 500 on several days. Unhealthy levels increase respiratory effects in the general population between 150 to 200. Then you've got 201 to 300, which is very unhealthy. This is where the red flags just go up and they say it's very unhealthy, which is causing a significant increase in respiratory effects in the general population. And then there is 300 to 500, which is hazardous. This is just where the WHO says it's unsafe to even go out, where there is a serious risk of respiratory effects in the general population. Remember, in Delhi, it's gone up to 799. That's 200, 300 more than even hazardous. This is how dangerous it is. Let's look at the levels of PM 2.5 in Delhi and in other metros today. These are straight from the Met stations. Our producers have put them together just hours before this broadcast. The latest figures from this evening in Delhi, the PM 2.5 level is at 253, which is in the very unhealthy category. In Mumbai, it is at 163, which is in the unhealthy category, 3 times above what is safe. In Chennai, it's at 105, 2 times above normal. In Kolkata, at 163, 3 times above normal. Delhi, of course, now the world's pollution capital, 5 times above what would be considered safe. Very, very hazardous this. I want to go across, we'll just hold this for a moment. I want to bring in some of our guests. We want to start looking at some of these figures because there are huge problems that are being associated with this. 150% increase, according to doctors, in respiratory illnesses over the last few weeks. 9 out of 10 people coming into hospitals now are complaining about wheezing and breathlessness. Children and the elderly are the worst affected, as also pregnant women. It's really bad for the fetus. 33% of Delhi residents, according to doctors, now have one form of respiratory illness or the other. 33%, that means 1 in 3 people around you has some kind of a respiratory illness. 40% of lung function is reduced in Delhi citizens. A doctor I spoke to said when they're cutting open, when they're examining hearts of young children, it almost seems as if these young children have been smoking for many years on end, and that is how dangerous this situation currently is. Sunita Narayan heads the Center for Science and Environment. She's joining us on this broadcast. I'm also joined this evening by Dr. Bharat Gopal. He's the senior chest physician and director of the National Chest Center, one of the top experts on pulmonary problems and lung infections in India. Thank you very much, Doctor. Great to have you with us on our broadcast. Sunita Narayan, I want to come to you first. Looking at this data, I am petrified. As someone who lives in the capital, Delhi now, the world's pollution capital, CSE put out a big study as well, which said how hazardous the situation was. Explain to our viewers, why isn't there greater awareness at one level? Because people have always thought that Beijing is the world's most polluted city, and that's where the real problem is. How long has it been that this problem has been in India, and we actually thought that with the CNG buses coming in, that things were coming under control? How quickly and how desperately has the situation gone out of hand?
Well, Rahul, if you look at it, for the last some years, we have been each winter raising the red flag. And, 10 years ago, 15 years ago, CSE began work on air pollution. At that time, Delhi's air was very black and dirty. We could feel it in the air. We pushed for CNG. We got CNG with huge struggle, managed to clean up the air. Air pollution levels were down as everyone could breathe better. At CSE, we were getting people calling us up and saying, my child is much better now, asthma is better. We all felt better. But then each winter the levels are going up because the car population has increased, diesel cars have increased, and each winter we have been raising the red flag. And this year, because we were finding that there isn't enough action, we actually bought portable air monitors, put them out, showed the data to show how dangerous it is. And I think now it is time people in Delhi said, we want action. We have a new government. This has to be on the agenda of the new government.
And that's what's perplexing. The fact that this is the single biggest health emergency in our country today, and the fact that you have a big election in Delhi and no one actually talks about it. It's nowhere on the public radar. The fact that we are breathing poison, the fact that ears are being chopped off our life, and everyone seems to believe that there is no problem.
Rahul, it's difficult to, air pollution is something which is people feel that there are more important issues. I think people in Delhi are fed up. More and more I hear people saying we are ill, we can feel our lungs are being strained living in Delhi. We come to Delhi, we cough. There is that anger. But I think because the actions are so much now difficult actions that governments have to take, that there's a certain helplessness, and I'm really glad you're doing this program. This is a big help. We need to raise the issue of the health emergency.
I'm coming to solutions and what needs to be done in a moment from now. But before that, I want to speak for a moment to Dr. Bharat Gopal about the experiences that you face when you're in the hospital. I was unwell a couple of weeks ago and I went and met a lung specialist, and he was telling me that everyone coming in has some form of a lung problem, and especially with young kids. What are you facing, doctor?
See, I think what Professor Narayan was saying, probably this is an invisible killer, and that's the biggest problem. We don't see. We would see a big car coming in and hitting us, but this is what is hitting us every day, every moment. The levels which we are talking are probably unheard of when I probably started practicing 15 years back. We saw a change in post-2000 when the problem started getting down, but now it's probably back to where we were. The fact that air pollution actually imperils human life is something which has been well proven all across the globe. What we are feeling in last few years, in fact, is a gradual increase in the number of respiratory patients who come to us. You are very right, it's every 1 in 3 which is actually a respiratory patient, which is a huge burden if you look at even Delhi, forget about whole of India. So this is a main issue, not only that you said the lives are being chopped off, it is the young lives which are being chopped off. That is very,
so we were speaking earlier in the morning and you said that when you examine the lungs of young kids, it seems as if they've been smoking for years.
Absolutely.
So how does a young kid's lung in Delhi compare with the life cycle and the lung function of adult who smokes?
Yeah, because I think one of the studies which was taken over in 2008 probably actually showed this way back, that in young children probably they are able to lose the lung function much more faster when you have pollution in those areas as compared to rural population in Calcutta. So this is the crux of the whole matter, that once these children are exposed to pollution at a very young age, they keep losing a certain amount of lung function at every possible exposure to lung pollution. What you actually were trying to portray is that there is an asthma, which is a reversible allergic sort of condition, and there is something called a COPD, which is in layman terms a smoker's asthma. What we are getting in young people, children, is a COPD type of illness.
So there comes a time, for example in China, they look at air pollution levels very carefully every day, and there are days when the government advises citizens not to go out.
Correct.
On pollution levels that are actually much lesser than the pollution levels we see in Delhi on several days. So are you saying the time has come for such emergency measures also to be rolled out, sir?
Absolutely. In fact, when I was, you invited me for this session, I was trying to look up the net, what actually things are being done, and I was very surprised that there is a Android app which is available, where you can actually look into Delhi pollution levels, which has been just rolled out.
We have that. We pulled that out.
Yeah,
we'll show that to our viewers in a moment from now.
Once with that, if you are actually looking at, probably the figure which I was coming down was something like 250.
Sunita Narayan, do you think the time has come when we push the panic button and say the government now needs to act in a fashion that the battle is a day-by-day battle, that there are days when you don't want young kids, old people, pregnant women going out into the open because it's simply not safe for them to be out?
Absolutely, Rahul. In fact, you see, the government has, after considerable effort on all our part, has issued something called a health air quality index. Now, as per the government's own index, if the PM 2.5 level crosses 250, then it is in the severely polluted stage. And at that time, government's own advisory says that the air is unsafe for even people who are healthy. Now, based on this, CSC has gone to the Supreme Court, and we have also gone to government saying that we would like you to ask for a emergency alert system which has been done all over the world, from Paris to Beijing, so that governments essentially tell people not to come out. Schools are closed. The people who are more vulnerable are told to leave their houses with masks on. So you create awareness in people that this air is actually dangerous, is unhealthy, and that we believe is very important. So we have gone out, we are asking either the court or the government to actually ask for this, and we will keep insisting.
Stay with me, Sunita Narayan, for a moment. I want to talk about those two apps. If our camera person can just zoom in, that Dr. Gopal spoke about here is Global PM 2.5. That's one, and then there is Global Air. You can download it as well. I'm not recommending these apps, but these are apps that are available. And if you go here, you can actually just type in the levels, and it pulls out from various monitoring stations. It says here New Delhi, this measuring station is at the US Embassy. 207, it says very unhealthy. Beijing is at 181, Shanghai at 168. You can put in your own cities like you do with the weather app. 207 at this time. This is global PM 2.5. There's also global air quality. You can look at this as well. Here the measuring station is at Anand Vihar in Delhi. 240, again very unhealthy. You can look at daily pollution levels, you can look at hourly pollution levels, and that just shows you how unhealthy the air that we are breathing is. So what is the government making of this crisis? I caught up earlier this evening with Union Environment Minister Prakash Javadekar, and I asked him about the data put out by the WHO, the CSE and Greenpeace, and whether the government was at all alarmed, and if they were, what do they intend to do about it? Here is Hot Pursuit with the Union Environment Minister. A new shocking Greenpeace study says that Delhi is now the most polluted city in the world. We're all breathing poison. Is the government aware, and what is it planning to do about it? Joining us on Hot Pursuit now, Union Environment Minister Prakash Javadekar. Thank you very much, sir, for joining us on Headlines today. I want to understand from you, A, whether there is an acceptance in government that Delhi is now the most polluted city in the world.
Absolutely. I understand the situation of air quality in Delhi and in many other cities is very critical, bad. But that's not only India's story, it's story of many cities, because the way we are growing. Unfortunately, what happened in last 10 years, this ministry became in a way license permit quota Raj. Instead, it should have devolved more energy on air pollution, water pollution, clean energy. We are laying that emphasis. And I'm now initiating a campaign in 20 cities, fresh air, my birthright. So people awareness also, action and pressure from people also. But as far as Delhi is concerned, let me tell you two things. First, we know the problem is serious, but I'm not going into squabbling or with Greenpeace or with whose data, because they monitor at one point, they monitor only on one parameter of 2.5 particulate matter. We are in Delhi mapping the air pollution from 25 different locations continuously on 5 parameters, and we are now upgrading it to 8 parameters. So we have a composite data. But
so what does your data show? So are you saying that Delhi is not the most polluted city in the world?
No.
Even according to your data, for 8 different parameters, Delhi is still the most polluted city in the world.
That is what I am saying. That is the first thing, is that you must know comprehensively of what you are doing, what is the status, and status is bad.
Even according to your data?
Yes.
So what is your data? So let's understand that. How does Delhi compare with other cities?
If 60 is the particulate matter or any level which is acceptable, we are already 2.5 fold or times worse than what it should have been actually.
Because it's not just Delhi, sir. According to WHO data, out of 13 of the worst polluted cities in the world are Indian cities.
That is why you don't bring the WHO and other organizations, because one-on-one there are many lacunas in their presentation. Sometimes I think that there is design in such presentations.
No, but why would there be a design? What is your insinuation, sir?
But that is what I am saying. Because if you take one day's one parameter, on one parameter, on one day you meter something and take concluding of it, and that is not the way. We must look air as a whole, and we must comprehensively
No, so when you
judge
say
it.
there's a design, are you suggesting, Minister, that
I'm not saying
you
anything.
use the word design?
Because
so are you saying that
that
there's
is
a
why I
deliberate
said
attempt to show India in poor light?
no, because that is why I don't want to take this debate to that level, because our air is not fresh in cities. We want to clean our air, we want to clean our water, we want to have clean energy, and we want to increase our urban greens more rapidly. That's our priority. We have to take action, and our ministry has already conducted 3 meetings with Delhi government. But as when the first report came, or even earlier reports on our own scales, which are bad, so we gave them many suggestions. Short-term measure.
No, so let's understand some of those, because this is something which impacts all. And you've been in power now for 8 months.
Yeah.
What have you as minister done to try and fix this problem, sir?
We have already taken it very seriously, and as I told you, that we have lost 10 valuable years. Nobody addressed this problem the way it should have been handled, and more importantly, we have taken it very seriously with all the states and particularly all the city administrations where the problem is real. So in Delhi, we had 2-3 meetings with all the concerned officials, and we had given them the roadmap of how to deal it within a shorter period and what are the long-term
So let's
solutions.
hear some of those.
That is what I will tell you. If you are not in a hurry, let me tell you. But the issue here is that is why I said that I don't want to dispute, and I don't want to go into that discussion whether that whose findings or Greenpeace findings are correct or not, because that's a small thing. We are a polluted city is a fact, and we have humility to accept that this is the condition. It has not come about in 8 months.
No, but I have, sir, here some things that Beijing does, for example, and there's data which you're disputing which says that Delhi is on certain days worse than Beijing. They actually have something called pollution emergency measures, where on certain days they say people shouldn't go out, especially young kids, pregnant women, old people shouldn't be out, and if you go out, people have to wear masks. Do you think we've reached a stage where people in Delhi also need to consider wearing masks, sir?
I have been in Beijing many times, and what I have seen, I don't agree that we are worse than Beijing. But I'm not disputing the science. What I am saying is, we have to take emergency measures also. We have to make the people's campaign also in it.
So you're not answering my question.
Train the people.
I'm saying, should there be days when in the morning, if your data shows that the pollution level is way above what is safe, that you tell schools, you tell children not to go out, or you tell parents to get emergency masks? Are we reaching that kind of a situation, sir?
I don't think we are reaching that level where we will have to ask our people not to move along. But yes, there are many things to be done, particularly those with asthmatic. We can give them alert that please do this, don't do this. A, and B, more importantly, we have to take action.
What about masks, sir?
Mask is not a preventive thing. It actually, it's afterwards what you do it. But I am going in a preventive thing. We are now launching a composite air quality index, one number, one code, one color, which will indicate at the same point at a public display, so people will be aware that how the health of that particular location is all about. And it will give constantly reminder to people, alerts to members. Then we will launch a campaign also where people will be also trained how they should combat this, what measures they should. Mask is a small part of it, but we are.
No, but Environment Minister, I'm asking you, do you believe the time has come for people to consider wearing masks when they go out?
I don't think.
Despite the data showing that we are 10 times the safety norms. The air in Delhi is polluted 10 times more than the safety norm.
Our data shows is 3 times.
3 times is bad enough, sir.
But that is what I am saying. That is what I said. Rahul, don't make this a television talk where one party versus another.
No, this is much more serious than, this is much more serious.
I am not doing it.
This concerns everyone's health, sir.
Greenpeace or who versus Environment Ministry. We are facing a real crisis in as many cities, and the world is seeing. So I am not bothered about who describes me the baddest, worst. We are worse, we are bad, and we have to improve.
But so
and to that end, we are doing technological innovations. we are taking policy decisions and we are taking short-term measures. Arvind Kejriwal has now taken over. I will be calling the relevant ministers, and even if Chief Minister comes, we'll call all the Delhi people who are responsible to manage the air in Delhi, and we'll definitely go ahead with this.
There are three big decisions that have helped control air pollution in Delhi, at least in the years gone by. One was compressed
CNG,
natural gas,
second
then
was metro,
the metro, and the third was moving polluting industries out of Delhi. 2 out of those 3 were done by